this video, you will see me demonstrating goniometry and manual muscle testing on a patient who has had a hypothetical right anterior hip replacement. I have informed the patient before this video on hip precautions, which is no excessive hip extension, no hip abduction, and no hip external rotation. You will see me perform goniometry on hip flexion, knee extension, and hip internal rotation, as well as muscle testing to hip flexion, hip adduction, and hip internal rotation as well.
Okay, so first what we're going to do is we're going to do a goniometry measurement of the right hip. So first we're going to have her do hip flexion because she had an anterior hip replacement, so she doesn't need to go into extension with her hip. So she can go into flexion. So bring that knee up as far as you can, hold it. So the axis of the goniometer will go right over the greater trochanter. So you can just palpate that, or even you can move the leg just a little bit to help find it. The stationary arm goes in between the ASIS and the PSIS, and then the movable arm lines up with the lateral epicondyle. So then this measurement would be 117 degrees. Okay, so now what we're going to do is we're going to do knee flexion. So she's just going to bring her foot back as far as she can. The axis of the goniometer goes with the lateral epicondyle. The stationary arm goes towards the greater trochanter, and then the movable arm lines up with the lateral malleolus. And this one is 148 degrees. Okay, so now what we're going to do is we're going to do knee extension. So what you want to do is you want to put a towel or some small bolster underneath the ankle so it helps flatten this knee out. So you're going to use the same landmarks that you did with knee flexion. So the axis is going to go over the lateral epicondyle. Stationary arm goes towards the greater trochanter, and then the movable arm goes towards lateral malleolus. Okay, and this one she actually has a little bit of hyperextension, so she's actually -1 degrees in hyperextension. All right, so now what we're going to do is we're going to do some hip adduction, since if she was to do abduction of the hip, it would break her hip precautions. So all we're going to do is we're going to locate the ASIS on both sides, and then she's going to bring this foot over as far as she can go. Right? So the axis of the goniometer is going to go over the ASIS. It's nearest to the test leg that you're measuring. And then the stationary arm is going over the other ASIS. The movable arm is going to go right through the middle of the patella. And on this measurement, you want to read the red outside numbers instead of the black numbers that you would read for every other measurement. So for this one, she has about 19 degrees adduction. All right, so now we're going to do some internal rotation of the hip because external rotation breaks hip precautions. So I'm having her seated. Normally you would do this with the patient laying prone with the knees off the table. However, since she did have an anterior hip replacement, I don't want to put any pressure and risk putting that leg into extension. So all you're going to do is the axis is going to go right over the anterior part of the patella, and then the stationary arm is going to go perpendicular to the table or the floor. And then all you're going to have her do is kick this foot out because the femur comes in. And then you line it up between the two malleoli. Alright, so she has about 24 degrees of internal rotation. Alright, so now what we're going to do is we're going to manual muscle test hip adduction of her right leg. So what I'm going to do is I'm going to grab this leg with my right arm and I'm stabilizing her pelvis with my trunk. And then I'm going to palpate right here on the medial part of the femur. So Maddie, go ahead and lift this leg straight up for me. Alright, you can set it back down. Alright, and do it one more time and I want you to hold it up. Okay, hold that for me. And you're going to apply resistance in the same area that you just palpated. So Maddie, do not let me push you down. Ready? Hold, hold, hold. Alright, good job. Alright, so now what we're going to do is we're going to manual muscle test hip flexion. So I'm going to stabilize her pelvis. You can hang on to the sides of the table if you'd like. All you're going to do is you're going to raise this leg up. So you're just going to bring it straight up like this. Alright, go ahead and bring it up. Okay. Bring it up one more time and I want you to hold it. Okay, and then do not let me push you down. Ready? Hold, hold, hold. Alright, good job. Okay, so now we're going to do a manual muscle test for hip internal rotation. So basically the table is doing the stabilizing for this one because you're going to need both hands. So what I'm going to have her do is bring her leg out like this. This hand is going to go to the medial side of the thigh and this one's going to go to the lateral side of the ankle. You're going to try and push out this way and then push in this way with this hand. Alright, Maddie, do not let me push you. Okay, ready? Hold, hold, hold.